My name is Lisa Joy, and I just wanted to hop on here to talk about how to deal with treating chronic pain, or what I like to call semi-chronic pain. Now, what do I mean by semi-chronic pain? Semi-chronic pain is, in many ways, the most common pain that we have. We have something that's going on, and then it goes away, and then it comes back, right? You're having a pain, but it kind of went away. Maybe it goes away for a year, it goes away for 2 years. But there are these parts of our bodies that seem to flare up on a regular or semi regular basis. And when we have an acute pain, an acute injury, if we actually physically have an accident or a moment where something happens, we are often more likely to take specific action to manage and handle that injury until it's healed, or at least mostly healed. When we have chronic pain or intermittent semi chronic pain, we are often less likely to treat the pain as it is occurring in the present moment. We sort of have a whole story attached to the pain. Maybe we're used to it. Maybe we're sort of like, oh, yeah, I kind of do this thing, or I kind of maybe do ice, or I take some Advil, right? Advil, Tylenol. These are common ways to treat or manage or deal with things as they come up, but they don't really get to the source. And it's often why we find that that intermittent pain or that kind of pain becomes semi-chronic, or it shows up and it goes away, and it shows up and it goes away. And we use the going away part where we don't have the pain as evidence that if we do nothing or relatively do nothing, it will just likely go away. But the truth is that that's not really true. It doesn't really work like that, which is why it keeps coming back. So I want to discuss, and this came from a conversation I have with a friend of mine who plays guitar, and she's having trouble with her right arm in what she calls her wing, right here behind the shoulder blade, kind of caught in this zone here between the spine and the shoulder blade. And this is something that she had before, and then it went away, and now it's back. And she's been really working out, trying to do some working out and working hard on trying to get more strength and mobile, but it's really stopping her from being able to play the guitar. And one of the things that I started talking about it with her is that you have to treat your body like it's going through something new. You have to treat it like it's an acute injury, like it's a brand new pain. Even if you had the pain yesterday and the day before and the day before and the day before that, and you did nothing about it, today when you wake up, if you're having pain, right now is the best time to start addressing it. So when we have an acute pain or an acute injury, there are a couple of things that are right at the top of the list to do that help to reduce and even eliminate the pain from happening. So you may have heard of the term RICE, and RICE stands for rest, ice, compression, and elevation. Now, I'm not saying that you need to use all of these methods, but rest and ice being the first two are two of the best methods of reducing pain, especially in an area that is in pain because of taking action, because of doing something, say playing the guitar, or typing, or driving, or holding your cell phone. Okay, these are some good examples. So if it hurts when you're doing things, then a good idea is to rest and to put your body in a position that actually feels restful. So just not doing the thing isn't enough, but actually providing support for the arm or leg or whatever part of your body is hurting, providing support and letting it be and letting it not have to do anything is going to give your body the opportunity to start healing and for that inflammation to come down. And the second thing is ice. If you have a spot on your body or an area that you can point to that has pain, and maybe you even are aware that it's again caused from motion, from repetition, then one of the greatest things that you can do to reduce that pain is to put ice on it. What's great is that ice is immediate. You put the ice on it, And 15, 20 minutes, maybe even 10 minutes later, it's numb, it's dulled out, and the pain has gone away. And sometimes that's enough. Maybe you only need to do it once. But in most instances with chronic and intermittent pain, you might need to do icing every hour or 2 hours on and off, and then every few hours for the next 72 hours. So 2 to 3 days. And maybe every time you work that area, you put ice on it for 2 full weeks as if it's a brand new injury because you need to treat your pain as it's happening now in the present moment, not like some old thing that sometimes is there. You need to treat it as it is right now. So, rest, ice, compression, if it's muscular, compression might work out. Some of the pain that we experience from especially instrumentation, in the neck, in the throat, in the mouth, may not function with compression. Compression might not work for that. Um, and elevation also, we might already be having pain in an area of the body that is above the heart. But again, I go back to rest and ice as two of the first great helpers in treating chronic and intermittent pain. And the second thing I want to talk about is, again, it's about treating yourself in the present moment. So if you are moving around and you're having pain and you're kind of doing something that helps and kind of doing something that doesn't help, and like this kind of does this and this kind of does this, and you're doing one of these things where you're like, oh well, if I just kind of move it around, yeah, I could kind of get at it, right? I see this a lot. Like, yeah, I just kind of moved around. And I say to a person, well, does that help? Well, yeah, it kind of helps. So again, you don't want to kind of help yourself because when you're kind of helping yourself, you're also kind of not helping yourself, right? If you have a pain and you want it to go away, you need to address it completely. You need to get as present with that pain as the pain appears in your body and is disturbing your mind and maybe even disturbing your ability to do things. So you really want to know what you're doing and have a plan of action. So, if you are working on learning how to heal your own injuries and you find a technique that helps, not just kind of helps, but all the way helps, you need to make a mental note of it and put it on your to do list every day or twice a day. You want to do the thing that really helps, not just kind of move it around, but you want to actually create a plan, an action plan like my shoulder hurts. And when I do this action, it hurts. And so I want to do this action because let's say I want to play the guitar. Then I need to figure out, what do I do? Is it a stretch this way? Is it a stretch that way? Is it putting a tennis ball back there? Is it going to the chiropractor? Whatever it is. And you need to put that at the top of the priority list. So, just like anything else, if you really want to make a lasting change, you have to give it the attention it deserves. You have to put your energy into healing that spot and not letting it just sort of cycle. Oh, well, it's great today. It doesn't feel bad, so I don't need to address it. No, today it feels great, so I want to keep building and make sure I can keep that pain at bay. And eventually, I'm doing these things regularly and I don't feel those pains at all. And it really, really gets addressed. So, when it comes to addressing your pain and addressing your mindset, you need to be present with what is actually happening right now. Don't worry about the past. I mean, you can use it for good information. If you have some exercises, let's say, from the past that worked to heal your pain, great. Pull that list back out, put them at the top of your priority list. But we want to interrupt the cycle of pain and rest, ice, compression and elevation are going to be at the top of the list in order to do that. If you know that your body is battling inflammation, doing things that reduce inflammation are great. Starting with getting hydrated and getting enough sleep, getting on a regular sleep schedule as best as you can. So remember, treat yourself as the instrument that you're trying to play because without you, none of this happens. None of your life happens without you.